Hi, my name is Ellen Lunsford, and today I'm going to take a few moments to talk to you about medication errors, which is taught in the Nursing 300 course titled Transition into Baccalaureate Nursing in the University of Mount Olive RN to BSN program. This video is an assignment for my Master's of Science in Nursing degree program at the University of Mount Olive. I have 4 goals and objectives for this brief lecture, and by the end of this video you will be able to define a medication error, acknowledge the impact a medication error could have on the patient, learn how to avoid medication errors using the 6 rights of medication administration, and to understand what to do when a medication error occurs. A medication error is any preventable event that led to incorrect medication use or failure to use a medication, could have potentially caused or did cause a patient harm or death. Medication errors cause up to 8,000 deaths each year in the United States. That's pretty scary. Whether the patient administers medications themselves at home or a nurse gives the patient medications in the hospital setting, errors are possible. One example of an error that occurred when I worked in the emergency department was a patient was to be given 30 units of regular insulin, which is 100 units of insulin per milliliter. The nurse drew up 30 units of insulin, and because there was a double verification system safety measure that was already in place in the hospital, another nurse accompanied that nurse to the room where the patient was waiting for the medication. Once in the room, the nurse verified the patient correctly by name and date of birth, along with the patient's armband, and scanned the armband. They verified the time the insulin was to be delivered or administered and compared it against the medication order. When the nurse scanned the medication, they found that the medication was incorrect. Although the number of units on the syringe was correct, the syringe was correct, the route was going to be correct, but there was an incorrect concentration of insulin, which made it an incorrect medication. If safety measures had failed, the patient could have received twice the ordered dose of insulin and could have caused harm. Emergency room staff, pharmacy staff, and management were all notified, and the safety reporting system was utilized according to hospital policy to record the event. And after an investigation, leadership found that the 200 units per milliliter of insulin concentration should never have been placed in the refrigerator in the emergency department. Careful inspection at the time of the event found that there was only 1 bottle of this insulin in the refrigerator. The rest were 100 units per milliliter insulin. Using the 6 rights of medication administration can serve as an intervention to help prevent medication errors. They are making sure and ensuring you have the right patient, the right medication or concentration, the right dosage, the right route, the right time, and the right documentation. Other ways to reduce medication errors is to decrease distractions when drawing up and administering medication, double checking medication against orders, label all medications and syringes, administer medications as soon as they are prepared. Don't carry them around and complete other tasks. Always follow your hospital's medication administration, documentation, and error reporting policies. It is essential that medications be administered safely to prevent harm. Patient safety is a top priority in all of healthcare. Medication errors are preventable, and it is essential that we as nurses acknowledge what steps are necessary to prevent them. Taking a few extra steps of medication administration duties can help reduce those medication errors. This brief lecture defined medication errors, acknowledged the impact they could have had on a patient's outcome, discussed a real situation, that could have caused harm to the patient, identified simple steps to prevent medication errors, and how to properly document administration of medications and their errors. This information was supported by current research found in an article titled Medication Error and Reduction and Prevention, and also an article Medication Dispensing Errors and Prevention. Thank you for your time and attention today. Please complete a short survey provided through the Nursing Student Center and mail it to my professor, Dr. Joy Kiefer, at jkiefer.umo.edu within the next 3 days. That's jkieffer at umo.edu. Thank you for your time.